Hello, I'm going to talk about the topic shift in thinking to reduce mother to infant transmission of hepatitis B. Definition: hepatitis B virus can be transmitted to the baby at the time of childbirth, and this can happen in a vaginal delivery or in a C-section when babies become infected with the hepatitis B. The morbidity and mortality that are associated with hepatitis B virus (HBV) infection have been overshadowed by the public health promise of other infectious diseases, including human immunodeficiency virus (HAV) infection, and tuberculosis and malaria. There is a growing realization that the disease burden from HBV infection in increasing despite the existence of an effective vaccine. Application in medicine. Infection in the neonatal period and childhood remains the leading source of new chronic infections and is a silent precursor to progressive disease. Thus, the prevention of neonatal and childhood infection by effective prophylaxis is crucial. Pros and cons. Pros. HBV vaccination is administered typically in combination with vaccines against diphtheria, tetanus, pertussis, polio, and Haemophilus influenzae type B. The first dose of HBV vaccine is given at 6 weeks of age to ensure immunogenicity of the combination. Schedules of either 3 or 4 doses are used for hepatitis B immunization. cons. Despite recommendations from the WHO, only 92 of 193 countries, 48% report administering the vaccine at birth. In Sub-Sahara Africa, the vaccine is currently administered at birth in 10% of neonates. Only 11 of 47 countries in the WHO African region have introduced a regimen of vaccination at birth. Issue applied in Ecuador. Fortunately, in Ecuador, we have a vaccination scheme that covers infections such as diphtheria, pertussis, tetanus, uh, hepatitis B, pneumonia, and meningitis caused by Haemophilus influenzae type B. In conclusion, HBV vaccination at birth, despite the challenges of poverty-affected countries to deliver vaccination in rural and insulated locales, is feasible, and the possibility that rapidly phasing in the timely administration of safe monovalent HBV vaccine within a few hours after birth could contribute to the interruption of mother-to-child transmission and avert preventable HBV infections in childhood. Hepatitis B is a disease severely liver that can be easily transmitted to others. It's very important that a woman find out if you have hepatitis B for I can get medical attention. It's also possible for a woman pregnant who has hepatitis B transmit the virus to your baby in the birth. Fortunately, there is a vaccine to prevent babies get hepatitis B, called hepatitis B, which is placed the first 24 hours of birth.
Hepatitis is a disease caused by virus. The hepatitis virus damages your liver. Many people who have hepatitis B don't know they have it because they don't have it, but they still have it. Hepatitis B is not cure, but they are meant to help you stay healthy and protect your liver. Hepatitis B can be spread through blood, sexual contact, and from mother to child. It cannot be spread through food, water, sharing, or exit. There is a safe and effective vaccine that can prevent hepatitis B. If you're pregnant and have hepatitis B, talk to your doctor about how you can protect your baby. You may need treatment during pregnancy. Your baby will need two shots right after birth, another shot at 1 to 2 months of age, and the last shot at 6 months of age. It's very important to get these shots on time. A few months after your baby finishes the shot, they would need their blood tested to make sure that they are protected from hepatitis B. In Minnesota, a public health nurse will work with you and your clinic to answer your questions and make sure that your child gets the care it needs. It's safe to breastfeed even if you have hepatitis B. If you have hepatitis B, it's important that you protect other people from infection. Sexual partners and anyone you live with should get tested and vaccinated for hepatitis B. You should always use condoms during sex. Don't share razors or toothbrushes. Hepatitis B is a serious disease. Talk to your doctor to learn more about how you can protect yourself and your family.